Hey folks, Dr. Joe Esposito here. I am very happy that you're with us today. What we're going to talk about today are signs that you might be low in vitamin C and vitamin D. Now, I picked these two together because vitamin C and vitamin D are so important for the immune system. And I don't know if you've heard, there's some issues with immune system problems going around lately. And the key here is get the immune system strong. And this is one thing that all doctors can agree upon. Some doctors say yes to vaccine. Some doctors say no to vaccine. Some people say quarantine, no quarantine, masks, no masks. It's a big issue, actually. But nobody's disagreeing that you should do everything you can to keep your immune system healthy. And so I thought I'd cover these two things. And how do you know you're low in vitamin C and vitamin D? But most people are, by the way. Vitamin D more so than vitamin C. But vitamin C and vitamin D are amazing to keep the immune system functioning the best you can. So how much do you need? Women who aren't pregnant need about 75 milligrams of vitamin C a day, men 90. I prefer that you do vitamin C and not ascorbic acid. Ascorbic acid is sold as vitamin C, and it's 1/8 of the vitamin C molecule. It's not the whole vitamin C molecule. Even though it's sold as vitamin C, I disagree with that. And so be careful if you're going to take a supplement, make sure it's whole vitamin C. Now, a half a cup of raw red bell pepper, a quarter of a cup of orange juice, a 3/4 cup of orange juice, half a cup of broccoli is going to get you about halfway to where you want to be. So it's not a lot, but if you're eating a good diet of fruits, vegetables, nuts, and seeds, chances are you're getting enough vitamin C. But everyone's different. So the question came up a while ago is, how do you know if you're getting enough vitamin C? Because everybody's different. You can do a little test by taking vitamin C supplements, and you take a supplement, take the recommended dose, and see if you get loose stools. If you get loose stools, you've reached what's called your bowel tolerance. Bowel tolerance is as much of whatever it is you're going to absorb in your bowels. Anything beyond that gets passed out. So what you do is you take, one recommended dose of vitamin C, pure vitamin C. Then take double that the next day, double that the next day. When you get loose stools, cut back to the last dose. Now, that's a way you can figure it out. But if you're eating enough fruits and vegetables, you don't need to do that. Now, Dr. Joe's Essential Source is a great source of vitamin C. That's where I get my vitamin C from. Plus, I eat a plant-based diet. I've been plant-based now for 35 years. So if you're eating fruits and vegetables, you're going to get plenty of vitamin C, and then I always take the Essential Source on top of it. And the minimum supplements I believe everybody should be taking are Dr. Joe's Super Greens and Dr. Joe's Essential Source. This way you know you're covering your bases on just about everything. So who falls short of vitamin C? People have a poor diet, people with kidney disease, people on dialysis, people that drink a lot of booze, smokers. You need an extra 35 milligrams of vitamin C per day to repair damage from free radicals if you smoke. Now, what are free radicals? Free radicals are molecules, and I always say they're like Pac-Man. They eat through things. Waka, 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 waka. And if you smoke, you're getting 100 trillion free radicals per puff of cigarettes. Now, the new trend is not smoking. It's what? It's vaping. Same thing. You're getting a lot of free radicals. Haven't seen any research on how many per puff of vape you're getting, but it's not good. And so getting more vitamin C is going to be helpful, but what's even more helpful is to stop smoking, of course. Okay, so people that fall short, if you have a bad diet, if you're under stress, if you have kidney issues, if you vape, if you smoke, chances are you need more. How do you know you have it? You don't heal as quickly as you used to. You cut yourself, it's slow wound healing. Bleeding gums, nosebleeds, and bruises. These can be signs of vitamin C deficiency. If you're putting on too much weight. Early research has found a link between low levels of vitamin C and higher amounts of body fat, especially belly fat. The vitamin can play a role in how well your body burns fat and energy. So it kind of goes along with the lifestyle. If you're eating a bad lifestyle, you're eating poorly, you're not going to be getting enough vitamin C, but you're also eating poorly, which can cause you to gain weight. So when you change your diet, you get more vitamin C and you're more likely to lose weight. So again, there's no downside to being healthy. And that's what I want you to understand. I can't think of one reason why you wouldn't want to be healthy except for one. And one thing is the bad food tastes good. And I know this. I used to be normal. I used to eat weird foods like you did. You do. And when I came to the realization that it's not worth it, it's not worth it for me to have a barbecue sandwich with cheese, because I feel terrible, and the more research I do, the more I realize how much damage it does to the body. So knowledge is power when it comes to this. And that's why this show and so many others like it that I do are great, because we convince people logically this is what you should be doing. And again, the website, drjoe.com, we have over 2,000 hours of podcasts, audio, video. We have blogs there. There's no reason why you shouldn't not be spending time on that website and learning tons of information. And then if you do have a question, you can always send it to me through the website, drjoe.com. There's a little bot that pops up. And you can send me questions, and I'm more than happy to answer your questions for you. So I don't see a downside to learning about how to get healthy. And I wish, my dream, when I become Grand Poobah of the universe, is that we teach in all schools, we teach people three things: how to be healthy, how to have a relationship, and how to manage money. These are the three things that are never taught in schools, and I think they should be the only three things taught in schools. And once we get that down, then we can teach the other stuff. But I digress. Other signs of vitamin C deficiency: wrinkled and dried skin. Vitamin C is an antioxidant, protects your skin, keeps your skin looking young. And that's one of my secrets. People say, Dr. Joe, you look about 15 years younger than you are. And it's Dr. Joe's Super Greens and Dr. Joe's Essential Source, along with a healthy diet, is one of the secrets that I use to keep myself looking young and feeling young and functioning like a younger person. So there's no reason why you should have to give in to age, especially if you're early on, 40s, 50s, 60s, 70s. If you're early on, I don't want you giving in. You get to 90 and 100, I'll let you give in a little bit. If you're tired and cranky, it's a very small study. 6 of 7 men who had low levels of vitamin C felt tired and irritable. Now, again, that's a small study. 6 or 7 men might just be tired and irritable, but vitamin C is helpful for that as well. Of course, we talked about the immune system. It's so important to keep the vitamin C levels up for your immune system because the immune system pretty much is everything. And we have this thing, COVID, that probably is never going to go away. And we have to keep our immune system strong. And if we keep our immune system strong and we develop healthy immunity to things like this, and we keep the immune system strong, well, then I think we'll finally turn the corner, as we have with every other disease known to man. But we've got to build up that healthy immunity, and you can't build up healthy immunity if you don't have enough vitamin C. And we're going to talk about vitamin D in a little bit too. Now, another thing that happened to me, and people always say, humanize yourself when you're a radio show host or a TV show host, is that several years ago, I got diagnosed with something called macular degeneration. Went to my eye doctor. He took a picture of my eye, and he says, Joe, this is not good. He says, you're way too young for this. You have macular degeneration. He says, and it's unfortunate, but chances are this can lead to blindness. And it is what it is. There's nothing that can be done for it. Nothing can reverse it. Now, I never accept that as an answer because I am Dr. Joe, and I figure things out. So I started taking Super Greens and Essential Source, and I took vitamin D and digestive enzymes. I take B-complex. I take omega-3 fatty acids. And a couple of years later, I went back to the eye doctor, and he took another picture of my eye. And I remember he sat there, Dr. Jarris, and he looked at me, and he looked at the computer, looked at me, looked at the computer, and he started shaking. And I went, uh-oh, I got a brain tumor. I said, what's wrong? He says, your macular degeneration is improving. He says, macular degeneration doesn't get better. He says, this is impossible. This can't be happening. And he showed me the picture, and sure enough, I had about a 40, maybe 60% improvement in my macular degeneration. And he says, what do you do? And I said, well, I take Dr. Joe Super Greens, Dr. Joe Essential Source. I take enzymes. I take omega-3 fatty acids, B-complex. He said, whatever you're taking, don't stop. Can I refer my patients to you? Anyone that has a macular degeneration, can I just tell them to order this protocol of supplements right off your website? I said, yes. And every month, I don't know where they're coming from, but when I talk to my eye doctor, they say, we send you patients every month. We just tell them to buy the supplements. And the reason I say that is vitamin C is very important to macular degeneration function. And Super Greens and Essential Source are a great source of vitamin C, but they're also a great source of other supplements, nutrients as well. And then, of course, with vitamin C, you might have heard something called scurvy. Before the 1700s, it was a deadly disease that happened among sailors. And this is why they call British people, as an insult, limeys. Because the British sailors would take limes on board and suck on the limes, it would prevent scurvy. And you don't need a whole lot it's relatively rare to have it, but you can lose your teeth, crack your fingernails, joint pain, brittle bones, body hair gets all corkscrew and crazy. And And when you boost your vitamin C, you start to get better in about a day. So you're not going to see a lot of cases of scurvy in modern society, but it's there. Okay, I still see it at period. I don't see it a lot, but when I do see it, I look at somebody's diet, and inevitably, when I see something like that, I say that this person has a horrible diet, and chances are not getting any vitamin C. So there's a lot of symptoms for vitamin C. The cure is very, very simple. Eat more fruits and vegetables. Of course, I take Super Greens, an essential source, and almost inevitably, the damage is stopped. Not sometimes reversed, but stopped. Another important supplement is vitamin D. And I want to talk about this for a second, because my background, again, is I'm board certified in chiropractic, orthopedics, pain management, double board certified in nutrition, BS in nutrition, certified in traumatic brain injuries. I've been in practice 37 years. I teach doctors and lawyers, continuing education. Of course, the radio shows we do. One of our shows, I believe, is the #1 health show in the country right now. So we have doctors and hospitals and students and everyone using these shows as learning tools. And one of the big issues that's come up a lot lately, of course, is the opioid epidemic. And opioid epidemic is very serious because when people get in pain, and I just talked about this when I was a guest on a show the other day, chiropractic is the most effective, least expensive treatment for pain. It's not the most profitable, because surgery is extremely profitable. You have back surgery, you're looking at $50,000 maybe. Chiropractic care, maybe $2,000, $3,000, $4,000. Okay, but chiropractic is more effective in most cases and less expensive with less side effects. Now, there are cases when you need surgery. I'm not saying surgery is wrong, but I cannot tell you how many patients, I don't even know, how many patients we save from being cut open. Because they came to us, they said, Doc, I don't want to have surgery. Doctor recommended it. What can I do? We get them on a treatment of chiropractic care. We get them on good food. We get them on vitamin C. We get them on supplements to help rebuild the collagen. We get them on digestive aids, maybe digestive enzymes to break down food. And amazingly, that case that was absolutely positively a surgical case is not a surgical case anymore. Now, I'm not blaming the surgeons. Surgeons oftentimes don't know that these other protocols exist. There are a lot of chiropractors that don't know these protocols exist. I teach them. And so vitamin D deficiency strongly exaggerates the craving for opioids, and supplements may help combat the addiction. So here we go. Vitamin D deficiency exaggerates craving for and the effects of opioids, potentially increasing the risk of dependence on addiction, according to a new study out of Massachusetts General Hospital. Exposure to UV rays, ultraviolet rays from the sun, causes the skin to produce a hormone called endorphin, which is chemically related to morphine and heroin and other opioids. In fact, all activate the same receptors in the brain. The receptors are places where things are absorbed. A study found that UV exposure raises endorphin levels in mice, which can then display behavior consistent with having an opioid addiction. So what does that mean? Endorphins are sometimes called a feel-good hormone because they induce a sense of mild euphoria. Studies have suggested that some people develop urges to sunbathe and go to tanning salons. They have many times are addictive personalities. Because when you're getting your vitamin D, which is activated by UVB rays in the body, it releases these endorphins, and the endorphins get you high, just like opioids do. So the theory led to a hypothesis that sun-seeking is driven by vitamin D deficiency, and the goal of increasing synthesis of the hormone to survive. This is, over time it's happened. Vitamin D deficiency can also make the body more sensitive to the effects of opioids, potentially contributing to addiction. So what that means is, if you don't have enough vitamin D, your body may not be experiencing pain relief. The endorphins are not doing their job. And again, we produce our own natural opioids. And so by vitamin D making the body more receptive to these things, it can actually help reduce pain. Now, as a chiropractor and as a pain management specialist, I'm also board certified in orthopedics, we want to do everything we can to get the patients out of pain as quickly as possible. And so chiropractic, again, most effective, least expensive treatment for back pain. But then we add things like Super Greens, an essential source, which is a plethora of nutrients to help the body utilize the natural pain production, natural pain hormones in the brain. GABA is another neurotransmitter in the brain that helps lower pain. So we try to do everything we can to get the body to deal with pain on a natural level and then hopefully get you off your medications if possible. Not everybody can come off their medication. Not everybody should come off their medications. But when we're able to get the nervous system, the digestive system, and the diet straightened out, it's a totally different approach for pain management. And that's why it's kind of fun. When I go to conferences, everyone knows I'm the guy who's not an anesthesiologist or something like that. And they'll stop me at these conferences and say, hey, Joe, I got a question for you. We got this patient. And I remember one time I was at a conference and I was in the men's room and some guy walks up next to me in the little, stall next to me there. And he starts talking to me. He says, hey, Joe, listen, I've heard your shows. I've seen your research. He says, I got a patient. And I said, can you wait till I'm done here? I'll be done in a second. But it's exciting to these doctors because the doctors only have drugs as their arsenal. And after you give somebody, let's say, 3 shots of cortisone or something like that in a joint, that's the most you can give somebody in that joint ever because it can develop osteoporosis. So after they've done this, the traditional route, they're kind of stuck. And these doctors want to know, too, what do? I have doctors as patients. They come in and say, Doc, I've tried everything else I can. I want you to start taking care of me. And my team of doctors does. So the reason I picked vitamin D and vitamin C is because they're very easy to fix the deficiencies. And it's something that we have a lot of control over. We can manage this so easily, so quickly, so inexpensively. So there's no reason why we shouldn't be managing something like vitamin C and vitamin D because it's literally pennies a day to improve someone's overall health. And for pain management, vitamin D, I feel, should absolutely positively be part of everyone's pain management protocol. So it's important because it keeps your bones strong. It helps you absorb calcium. So vitamin D helps you absorb calcium. Vitamin K2 will then take the calcium and drive it into the bones. So the supplement that I take every day, unless I'm out in the sun, is Dr. Joe's vitamin D with K2. It's on the website, drjoe.com. And I take 5 drops a day. That's all you need is 5 drops a day. Now, if you're feeling under the weather, if you're feeling sick, I can take 50 drops a day for 3 days and then cut back to 5 drops a day. So 5 drops a day for most adults is all you need. It literally costs pennies. It does so many things. And you need to have the K2 with it because if you're just taking D3, you're absorbing the calcium, but it doesn't know where to go. And then the calcium can build up in the joints and the blood vessels and muscles. So the K2 is very important. So that's why the supplement I take is vitamin K2 with vitamin D3. And again, it's on the website, drjoe.com. The parathyroid glands. Parathyroid glands helps you absorb they manage calcium in your blood. And the thyroid's in the throat, the parathyroids are around the outside. So when there's sufficient calcium in the diet and sufficient vitamin D, everything works properly. If there's not enough vitamin D, you're not absorbing enough calcium, so the parathyroids will go into the bones and steal calcium to put it back in the blood. Now, my mother had high calcium levels. So the doctor said, well, you have high calcium levels, let's just remove your parathyroids. They cut out her parathyroids, it didn't do a darn thing. They didn't dig deep enough. Sometimes it's not always so clear. Calcium levels, parathyroid, cut out the parathyroids. Didn't work. Wasted surgery, wasted parathyroid glands. So we got to try to figure out why things are happening. And that's why I like to try a conservative approach first. Chiropractic first, drug second, surgery last. And in our offices, what kind of separates us from everybody else is we'll do chiropractic, we'll work on stomachs, acid reflux, heartburn, burping, gas, bloating. Many times we can pull the stomach away from the diaphragm and solve that problem. Every patient that comes in gets a nutritional workup. We recommend food. We might recommend supplements. We try to get a whole protocol together for every one of our patients. And I don't know of any other clinic anywhere in the world at any price that does all the things that we do for our patients. So if you would like to make an appointment, you can go to our website, drjoe.com, and you can book it right online. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We accept almost every insurance known to man, almost. Medicare, Ambetter, car accidents. Folks, if you're ever in a car accident, if the car was damaged, you were damaged 100% of the time, in my experience. You need to come see us immediately. Don't waste time. Let me see if the pain goes away. Come see us immediately. It can adversely affect your health, and it can also adversely affect your case. Now, Even if you hit if you cause the accident, because 50% of the people in accidents cause them, you need to come see us. It's still your health, folks. And chances are you might even have coverage for your car insurance, even if you cause the accident. That covers your treatment with us. So if you want to make an appointment, drjoe.com. We're talking today about vitamin D and vitamin C deficiencies. And the best source of vitamin D, of course, is going to be getting out in the sun. But I'm not out in the sun every day. If I'm out gardening, if I'm out in the sun, I will then go ahead and skip my vitamin D for that day. But if I'm not, which a lot of times I'm not, I'm in studios and TV and radio and offices, I'll take 5 drops of Dr. Joe's vitamin D, along with, of course, Super Green Essential Source. And I have my own protocol. I take omega-3s, I take digestive enzymes, I take B-complex. So we create a protocol for you, whatever works best for you. So if it's difficult for you to get out in the sun, I do recommend you do take supplements. Now, if you have cystic fibrosis, Crohn's disease, colitis, weight loss surgeries, obesity, kidney and liver disease, these are all signs that you might be low in vitamin D. These are things that can cause deficiencies. Other things, if you're old, as you get older, things don't work like they used to, and age become a factor with your vitamin D level. If you're homebound, you rarely get outside, that becomes an issue. The darker your skin, the less vitamin D you're probably going to have. And a woman's breast milk only contains a small amount of vitamin D. Oftentimes, infant formulas also only include a small amount of vitamin D. Infants are at risk of not receiving enough vitamin D. So people ask me, how much for an infant? 1 drop of Dr. Joe's vitamin D. It's on the website, drjoe.com. If you're taking steroids, if you're on laxatives, if you're on cholesterol medications, if you're on seizure medications, if you're on tuberculosis drugs, if you're on certain weight loss drugs, these can also lead to vitamin D deficiencies. Severe lack of vitamin D can cause things like rickets. We talked about that with vitamin C. Again, vitamin C helps the bones stay healthy, but vitamin D absorbs the calcium, and vitamin K2 drives it into the bones. Lack of vitamin D, not so obvious. That's the problem with it. If you're tired, if you have bone pain, muscle weakness, mood changes like depression, all of that can lead to vitamin D. Now, we can do vitamin D tests in our office, but here's something I want you to do. Every time you get a blood work done, make sure you get your vitamin D done. You might have to ask for it. The accepted level is about 30 nanograms per milliliter in your blood. I want you to get to about 60 nanograms per milliliter. At 60 nanograms per milliliter, your risk of many, many diseases drops dramatically. So 30 is like keeping you alive. It's survival. I want you in thrive level, not just survive, but thrive. If you take too much vitamin D, don't think more is better. It's not. You might get increased thirst and urination, poor appetite, constipation, muscle weakness, ataxia, which is when you start slurring your words in your speech, nausea. So don't think more is better. Vitamin D is a fat-soluble vitamin. It's really not a vitamin. It's a hormone, actually. But too much vitamin D can be bad, too. So I say 5 drops a day. So, folks, it's a really easy protocol. If you want to put together a wellness plan, and we do that. Most of you have health insurance, but you don't have a health plan. You want to have a normally functioning nervous system. That's where chiropractic comes in, pinch nerves. You want to have a normally functioning digestive system. If you have acid reflux, heartburn, burping, gas, Crohn's, colitis, irritable bowel syndrome, come see us. Almost every case, we get amazing results. It's not hard if you follow our recommendation. And then you want to make sure you have a good diet. If you don't know what to eat, go to the website, drjoe.com, and type in, so what can I eat? Listen to the show we did on what can I eat. If you want to make an appointment to come see us, and I think you should, stop suffering. Just make the appointment. drjoe.com, you can put it right online. You can call us. We accept new patients on almost every day of the week. Again, in the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. I'm Dr. Joe Esposito, drjoe.com.